New tonight, finding relief from pain for some doesn't involve consuming potentially addictive painkillers.
The CDC says nearly 50 million Americans live with various forms of physical discomfort. Some turn to opioids or surgery for relief. But two chiropractors believe an improved quality of life can happen with some key adjustments at the source.
TV5's Blake Keller underwent his own treatment to see how their clients are now living life pain-free.
Pain in your neck, back, your head, wherever it is, it's not a fun way to live. But at Massa Chiropractic in Saginaw, getting rid of long-lasting agony for good is the goal.
So Brittany and I have both been chiropractors for about 3.5 years.
Aaron is a third-generation chiropractor working alongside his dad in the building his grandpa built in 1959.
Anybody in general population looking to get pain relief or a good pain alternative.
And then, yeah, I'm going to lower you down here.
You can get a quick fix or address your pain long-term. And for some clients, their trips to the chiropractor mean much more.
We've had veterans, we've had people in recovery in and out of rehab houses. We've also had people who have to get surgery. Some of these people, especially if they're coming out of addiction, they're struggling with things like getting out of bed in the morning, putting on their socks and shoes because they're in so much pain, as everyone struggles with it.
Their clients look to ease pain without giving in to the typical path of relieving it with opioids.
And they're trying to avoid taking pain medications because they may have had addiction issues in the past and they really want to avoid using them again.
The U.S. Department of Health and Human Services reports in 2019 about 10 million people over 12 misused the drug.
Anytime you're taking an opioid or just a non-opioid pain medication, pain reliever, all you're doing there is alleviating symptoms and potentially covering them up short term.
It's like a Band-Aid on an open wound.
And it's easy to get into using them and to keep using them too. Once their prescription expires, some of them are left in pain still.
Let me know if and when you get hip or back pain.
So Dr. Aaron and Brittany Massa brought me in to see what a treatment plan might look like.
A little worse on this side. And then if I bend the foot, worse yet?
Yeah, it's pulling.
You've been using medication, you've tried other things that's not working.
So we're gonna bend this leg.
We generally would set up a treatment plan where we're gonna adjust them, do some soft tissue work.
So we're gonna do the same thing on this side. And just let me know if you do feel any pain.
I was able to get a massage, an adjustment, and did some stretching exercises.
Go ahead and bring that knee up to your chest again.
And instantly felt relief.
One more over here and then we'll switch, okay?
For Massa's patients, they see the change right before their eyes.
And then some people, I mean, will cry because they're so upset and they're hurting so much because they're missing out on so many things in their day-to-day life. And so it's nice to see the transition. Your quads feel pretty good. After a few times of them coming in, seeing them like smiling, walking a little bit better, telling you about something they did over the weekend that they would have never done before. You can do any of these.
And they're not only seeing results in their office. In one 2020 study from the American Academy of Pain Medicine, patients with pain in their spine who saw a chiropractor had half the risk of filling an opioid prescription.
And we always are trying to give people the tools to take care of themselves.
If your pain was in your lower back here and then your...
That's the reward at the end of the day, and that's the big payoff, is getting people back into doing what they love and making them feel, you know, good and like they can do the things they enjoy doing again.
So, of course, there are other approaches to treating pain like physical therapy and sometimes surgery, but the Massas want you to know you do not have to live in pain for the rest of your life. There are plenty of options out there. For this special report, I'm Blake Keller.